Ever wonder why diseases are taught in nursing school the way they are? It's not about memorizing endless lists of symptoms. Today, you'll learn the secret framework nurses use to understand any disease logically. It's a game changer for nursing students and anyone curious about how healthcare professionals think. So, how do nurses really understand disease? It all starts in a place you might not expect, with normal. Before you can ever grasp what's wrong, you have to master what's right. That's why nursing education spends so much time on anatomy and physiology. We're talking about the body's blueprint and how it's supposed to operate. Think of the heart. You have to know how it normally pumps blood, the electrical signals that keep it beating steadily, and the pressure it maintains in the blood vessels. This isn't just background information, it is the absolute foundation. Normal comes before abnormal, every single time. Without this baseline, a disease is just a random collection of facts. Every deviation, every symptom, every lab value that's off suddenly has meaning. It's the first and most critical step in thinking like a nurse. Pathophysiology isn't just a scary-sounding word, it's the story of what changed. Instead of just listing symptoms, a nurse thinks, okay, normal blood pressure is 120/80. Why is this patient's 180/100? They focus on the mechanism of the disruption. This is where the logic really clicks in. Answering this why is far more powerful than just memorizing that high blood sugar is a symptom of diabetes. This approach connects the dots and turns a complex disease into a logical sequence of events. Now for the most important step, the one that truly defines nursing. After understanding normal and identifying what went wrong, a nurse asks, what does this mean for my patient right now? This is all about nursing relevance. A doctor's job is to diagnose and treat the disease itself. We connect those physiological changes directly to what we need to watch for, what we need to do, and what we need to prioritize. If a patient has heart failure, the heart isn't pumping effectively, so a nurse thinks, what will I see? I'll probably see fluid backing up into the lungs, causing shortness of breath. I'll see swelling in the legs. So, my priorities become monitoring their breathing, checking for swelling, and tracking their daily weight. It's about taking the pathophysiology and making it practical and patient-centered. Understanding the changes tells us what to look for, long before it becomes a crisis. This focus on monitoring and managing the patient's response is the core of what makes nursing care so essential. It is about understanding the why behind the disease to anticipate the what for the patient. The secret to thinking like a nurse isn't about having a bigger brain or a better memory. It's about using a smarter system. First, you master normal function. What is the body supposed to be doing? Second, you identify the disruption. What changed and why did it go wrong? And third, you determine the nursing relevance. What does this change mean for my patient, and what am I going to do about it? When you study disease this way, normal, change, relevance, you're not just memorizing for an exam. You are building a mental framework that you can apply to any disease you encounter. This logical process helps you understand faster, remember longer, and feel more confident in your knowledge. You'll be able to predict symptoms, understand treatments, and prioritize care effectively. This is how you move from being a student who memorizes facts to a clinician who thinks critically. I hope this framework helps you on your nursing journey. If you found this breakdown helpful, please give this video a like and subscribe to Untometed Hub. We're all about making complex nursing education clear, simple, and logical. Thanks for watching, and I'll see you in the next video.